America's seniors and SSI recipients are asking a painful question right now. How can a 2.8% COLA raise possibly keep up when inflation on basic needs is nearly double that? The official 2026 adjustment may sound like progress, but it's nowhere near enough to match what's happening in grocery aisles, gas stations, and pharmacies. Essential goods are still rising around 4.7% a year, according to CPIE data that tracks older Americans' costs. At the same time, Medicare Part B premiums are expected to jump another $10 to $12 monthly. That means most of this raise disappears before it even hits a recipient's account. Many viewers have also written in worried about delayed November EBT reloads and whether USDA funding will stretch far enough to cover benefits on time, a sign of how fragile every dollar has become. This isn't just about numbers, it's about survival. Viewers from across the country say they're skipping meals, rationing medication, or choosing between food and rent. A 2.8% adjustment might look decent on paper, but for people already behind on bills, it feels like another slap in the face. If Congress truly measured real inflation instead of bureaucratic averages, COLA would be at least 5%, the minimum needed to keep pace with today's economy. So, let's break down the new 2026 SSI payment amounts, what's changing, and what's dangerously staying the same. The Social Security Administration officially confirmed a 2.8% COLA for 2026, affecting more than 70 million Americans on Social Security and about 7.5 million SSI recipients. That adjustment translates to the smallest real-world raise in years once you factor in inflation. During the pandemic years, COLA hit 8.7%, 2023, and 3.2%, 2024. Now, cutting back to 2.8% leaves seniors with less purchasing power than they had even 2 years ago. Housing costs are up nearly 6%, electricity up 4%, and food still 5% higher than last year. When fixed income rises slower than prices, every increase feels like a loss in disguise. For SSI recipients, this number determines the ceiling for their monthly benefit, not their actual take-home amount. That's why a 2.8% boost may add only $27 for many individuals, a difference easily erased by one copay, one trip to the pharmacy, or one utility bill increase. A $27 raise sounds nice until your grocery bill goes up $50, one commenter wrote. A perfect summary of this year's frustration. The COLA formula, based on the CPIW index, fails to measure what seniors truly spend money on, especially healthcare and rent, leaving millions short each month. Starting December 31st, 2025, the maximum SSI payment for an individual will rise from $967 to $994 per month, an increase of just $27. For married couples, the 2025 maximum of $1,450 increases to $1,491, or $41 more. Those are the maximums, not what everyone receives. Actual checks are often smaller because of income offsets, shared housing deductions, or state supplements that vary widely. For example, a recipient sharing rent with family or receiving help with groceries may see a lower check due to the in-kind support and maintenance rule. In 2025, the average SSI benefit was around $720 a month, barely half of the federal poverty line. Even with the 2026 adjustment, the average will remain under $750. That's less than $9,000 a year to survive on in a country where average rent for a studio apartment tops $1,100. The math simply doesn't work, and seniors know it. A 2.8% raise means more struggle, not relief. The truth is, SSI payments aren't keeping pace with basic human needs. While benefits inch upward, SSI asset limits have been frozen since 1989. $2,000 for an individual and $3,000 for a couple. That's 36 years without an update, even though inflation since then has quadrupled prices. If the $2,000 limit had risen with inflation, it would exceed $5,500 today. But it hasn't, and that means one small emergency fund, tax refund, or gift from family can trigger benefit suspension or even loss of Medicaid. Recipients are essentially punished for trying to save money. This outdated rule forces millions to live paycheck to paycheck and prevents them from preparing for emergencies. SSA's own data shows 1 in 6 SSI beneficiaries lose eligibility each year because their savings briefly exceed the limit. Imagine losing your entire income over $100 in a checking account. That's not welfare abuse, that's policy failure. Until Congress passes bipartisan bills like the SSI Savings Penalty Elimination Act, stalled since 2023, this injustice will continue into 2026 and beyond. The first increased SSI payment will arrive December 31st, 2025, not January 1st. That's because January 1st is a federal holiday, and when a payday falls on a weekend or holiday, SSA releases payments 1 business day earlier. So SSI recipients will be the first among 75 million beneficiaries to see the 2026 raise in their accounts. This happens every year and gives a small psychological lift going into the new year. However, the early date can create budgeting confusion. Many recipients assume the December 31st deposit counts for the new month, but technically, it's January's payment. This means there will be no payment in January itself. Recipients must budget carefully to make that check stretch through the first month of 2026. Inflation, rising rents, and food costs mean this single payment will vanish quickly for most families, especially when heating bills and Medicare deductions hit around the same time. Medicare Part B premiums are projected to rise from $174.70 to about $185 a month in 2026, according to Centers for Medicare and Medicaid Services forecasts. That's roughly a $10 increase, and for dual-eligible SSI beneficiaries, it often erases most of the COLA gain. While many low-income recipients have state Medicaid programs cover their premiums through the QMB or SLMB programs, eligibility thresholds vary by state. Those living just above the cutoff may end up paying the higher premium out of pocket, canceling out their raise. This creates a cruel cycle, a raise that isn't really a raise at all. A $27 COLA gain minus a $12 premium increase leaves only $15 to cover everything else. Add rising drug copays and deductibles, and many seniors will see less money available each month despite the official increase. That's why advocates are urging Congress to tie future COLA formulas to the CPIE index that reflects healthcare inflation, the largest expense for retirees and disabled individuals. Across the country, food prices remain a top worry. The USDA projects a 4 to 6% increase in food costs for 2026, and millions of SSI recipients also rely on SNAP EBT benefits to eat. During October and November, many states issued warnings that federal funding delays could affect timely reloads if budget negotiations stall. While SSI and SNAP are separate programs, they serve the same households, so any delay hits the same people twice. Rising rent and food costs mean many seniors are already using credit cards or food banks to survive the month. The 2.8% COLA does nothing to solve that. Eggs are up 20% year over year, fresh produce up 7%, and dairy costs remain high due to transport and feed expenses. That makes a $27 raise feel almost insulting. EBT benefits under SNAP average about $202 a month per person nationwide, a number that has not kept pace with inflation either. When the cost of living grows faster than benefits, poverty deepens, and the cycle of dependence worsens, a warning that Congress continues to ignore. To recap, SSI recipients will see a 2.8% COLA increase in 2026, raising the maximum to $994 for individuals and $1,491 for couples. Asset limits stay frozen at $2,000 and $3,000, and the marriage penalty remains unchanged. Payments arrive December 31st, and Medicare premiums will likely offset much of the gain. This system has been stuck for decades, and seniors deserve better. If lawmakers adjusted these numbers to match modern inflation, the minimum SSI benefit today would exceed $1,200 a month, a figure that would actually lift millions out of poverty. So, what will your 2026 raise really cover? Rent, food, or medicine? Drop a comment below and share your story. If you agree that 2.8% is not enough, hit the like button and help spread this message so Congress feels the pressure to act. Every share and comment matters, because silence is how they keep these rules frozen for decades. This is Social Security Post, the place where your voice and your facts matter. Stay informed, stay vocal, and let's keep fighting for the benefits you've earned.